Good evening, everyone, and welcome to today's wonderful session. Daily we will study together is the promise. And now in this last moment before exam, short videos. In 3 minutes, we are going to have the revision of at least 10 to 15 points every 3 minutes. And I am going to upload all this into the Incus learning app. So don't forget to download, and thousands of videos are available for you for the last moment revision. And you can bookmark them and also can do the revision. So let us catch up these snippets, which are the classical vignettes for the examiner to test you in the tomorrow's NEET PG exam. So with that preamble, let's make the great beginning, Doctor. Olfactory pathway. So you should remember olfactory pathway. What is one single point you want to remember, Doctor, when it comes to the olfactory pathway? It is the highest cortical center is ipsilateral, whereas all other sensory pathways, if you take, they have a crossed cortical representation. That means right side facial nerve will have a representation on the left side cortex, whereas olfactory pathway highest cortical center is ipsilateral, is what you have to fundamentally remember. Then what is that secret point you want to remember about the trigeminal nerve? The trigeminal nerve. Good to see Jitendra, Dr. Nick, Dr. Avilo, and many more who are all online. I hope you all have downloaded the Incus learning app and enjoying many 3-minute videos that we will be uploading. Almost 1,000 videos every day is the plan on a lot of concepts. You also try to upload while studying. एक 3-minute video बनाओ और चढ़ाओ, 3-minute video बनाओ चढ़ाओ, ताकि पूरा दुनिया आपके साथ मिलके पढ़ाई करेगा, आपको फैन करेगा, फॉलो करेगा, मैसेज करेगा, आपके साथ स्टडी पार्टनर बन जाएगा. So there's a lot of fun in studying. Student to student review is the best way, and Incus learning app is such a wonderful platform. So Doctor, continuing our journey, trigeminal is the largest nerve. And you need to remember that the trigeminal passes through the Meckel's cave, is what I want to underscore to all of you. Meckel's cave. And about the vagus, what will you remember? One single MCQ, which is a favorite question of the examiner. Typically, vagus is the longest cranial nerve in the body, and it is the one which has the most extensive distribution. That's the reason you need to remember. Then what about the trochlear nerve? Can the online students can punch whether the voice is loud and clear for all of you? Dr. Sanvi Rai, Dr. Nick, Jitendra, Avilo, can you please punch whether the voice is loud and clear for all of you with a smooth broadcast? So Doctor, with regard to the trochlea, the only cranial nerve that arises from the dorsal aspect of the brainstem, trochlea, the longest intracranial course, Which motor nerve is having longest intracranial course? Is the favorite question of the examiner. Which you need to remember. Now, it is the trochlea, and the only cranial nerve to undergo complete internal decussation before emerging, and it supplies the contralateral superior oblique muscle, is what I want to underscore to all of you. Very good. Thanks for the feedback that the transmission is clear. Very good. Now, abducens. What are the 2 points which are the favorite MCQs of the examiners? The most common cranial nerve which is affected whenever there is a rise in intracranial tension, it is the abducent. And whenever there is any cerebral aneurysm that lead to compression, it is the oculomotor and abducent most commonly involved in such a aneurysmal compression. So typically oculomotor is compressed by PCOM aneurysm, posterior communicating artery aneurysm is what you have to emphatically remember. Now, you should know all the numbering, doctor, when it comes to cranial nerves. 3rd and 4th cranial nerves, midbrain. 5th, pons. 6th, 7th, 8th, pontomedullary junction. 9th, 10th, 11th, 12th, attached to the medulla. This is one of the favorite MCQ in the tomorrow's exam. Now, doctor, of all the cranial nerves, the most commonly paralyzed cranial nerve hota hai facial nerve, and the one which has the longest course through the bony canal of the skull, which cranial nerve? If the examiner asks that question, that is once more facial. Now, the next favorite, TikTok like 3-minute video on the Incus learning app for you to do just on the go on the mobile app. Download it on your Android mobile app. Shortly we are going to come up with the iOS also. Keep all these 3-minute snippets, bookmark them, and last moment you can very much do the revision, right? So now, musculocutaneous nerve. First of all, what is root value? Favorite topic of the question of the examiner. C567. Musculocutaneous should be remembered because it is the nerve of the anterior compartment of the arm. Musculocutaneous is the branch of the lateral cord of the brachial plexus. And what are the muscles supplied by the musculocutaneous, doctor? Remember BBC, British Broadcasting Corporation. Biceps brachii, brachialis, coracobrachialis is what you have to emphatically remember. And what nerve, that's musculocutaneous nerve, continues into the forearm? It continues as the lateral cutaneous nerve of the forearm. And what happens when the musculocutaneous nerve lesion is there? Biceps brachii is involved. That's the reason there is a loss of supination. There's a loss of biceps jerk. There's a loss on the sensation on the lateral border of the forearm because it is the lateral cutaneous nerve of the forearm. And there is a decreased flexion at the elbow is what you need to remember. So these are the 5-6 points you should remember, doctor, in a 3-minute video. Must definitely कल के entrance में यही question पूछेगा examiner. So please don't forget, Incus learning app. You all should become my brand ambassadors. You should make your classmates to download. all the forums, please post this download link and talk good words about it. Also, please go to the Google Play Store. Please write some good things, good comments about the app, how it helped you in your exam. Also, make a short video, most important. Your own short videos, 2-minute, 3-minute videos of the revision, and then post them on the Incus Learning app. I'll be waiting to see how many of you are going to post. So, Doctor, boxer's muscle, you should remember, serratus anterior. Then muscle of marriage is medial rectus. Muscle of honeymoon is the sartorius. Swing muscle, pronator quadratus. Climbing muscle, latissimus dorsi. Muscle of divorce is lateral rectus, because lateral rectus lead to abduction of the eye, divorce. That's how you need to remember. Then muscle of the rape or anti-rape is gracilis. Tailor's muscle, sartorius. How the tailor sits, putting one leg over the other, for that, sartorius. The red muscles are all postural muscles. White muscle example is an extraocular muscle. Spurt muscle होता है brachialis, shunt muscle होता है brachioradialis. And which muscle is used for grinning? Risorius. For smiling, laughing like Ghatotkacha. Ha ha ha. It is the zygomaticus major. And whenever there is a grief, then it is the depressor anguli oris. In the grief is what you need to remember. Now, a lot of times examiner asks the question, there are muscles which are having dual nerve supply. So the examiner's favorite question is, what are the muscles, what is their dual supply, and what are the two nerves which are supplying the same muscle? So agar brachialis liya jaye to, musculocutaneous is motor and radial is proprioceptive. Similarly, adductor magnus, very favorite question in our anatomy days. Posterior division of the obturator nerve is one thing that is supplying the adductor part. Whereas the tibialis part of the sciatic nerve is the one which is supplying the hamstring part. Pectineus, it is the femoral nerve's anterior fibers. Anterior fibers are supplied by femoral nerve, pectineus. It also has a dual nerve supply. And posterior fibers are by the obturator nerve for the pectineus. That is what you should emphatically remember. Now, digastric, it also has dual nerve supply. Mylohyoid branch of the mandibular nerve supplies the anterior belly. Facial nerve supplies the posterior belly, is what you should remember. Flexor pollicis brevis. Superficial head is by the median, deep head is by the ulnar. Flexor digitorum profundus. It is the anterior interosseous branch of the median, supplies the lateral half, whereas the ulnar is the one which supplies the medial half. Biceps femoris, it is the tibial division of the sciatic nerve that supplies the long head of the biceps femoris, whereas the common fibular nerve is the one which supplies the short head. देखो भैया, एनाटॉमी होता है पूरा बट्टी मारने वाला आइटम, गर्मा गर्म बट्टी मारना, डॉक्टर मुरली भरद्वाज के साथ। और इंकस लर्निंग ऐप को डाउनलोड करो, वीडियो बटन दबाओ, और एक के बाद एक आपको वीडियोस रहेगा. Just keep swiping. Now I'm talking to almost 10,000 teachers, medical teachers, very passionate medical teachers across India. They said, wow, we are so happy, Dr. Murali Bharadwaz, you came up with this Incus learning app, and we are all going to upload laparoscopic procedures, surgical procedures, clinical cases, everything. They are going to create a 3-minute video, क्योंकि हमारे जिंदगी ऐसा बन गया, ईमेल को छोड़ के हम ट्विटर के जमाने में आ गया, यूट्यूब को छोड़ के टिकटॉक के जमाने में आ गया. Smaller, shorter, bite-sized, sweeter to learn. So that is the whole concept of Incus learning app, which makes learning almost free for all of you. So biceps femoris, tibial division of the sciatic nerve is the long head, and common fibular nerve is the short head, is what you should remember. Then another purely batti marne wala item. What are the primary centers? And what is the age of appearance of the ossification centers? I always used to hate this question, but there is no other way. You have to mug it. Femoral shaft, 7th week. Humerus radius ulnar tibia shaft, 8th week. Ischium, 3rd month. Pubis, 4th month. Calcaneum, 5th month. So, primary centers and the age of their appearance in fetal life. A bookmark करना Incus learning app में, और आप आपके डैशबोर्ड में गए तो बुकमार्क शॉर्ट वीडियोस बोल के रहता, वहां इसको ले जाके डाल दो, और जब भी टाइम मिले वो रिवीजन करो वीडियोस को, बट्टी मारने वाला आइटम्स को. बराबर. नाउ डॉक्टर, after the viability, what are the primary centers? Talus develops 6th to 7th month. Femur, lower end by 9th month or at just before the birth. Tibia's upper end at 9th month or at just before the birth. That's what you need to remember. So at birth or in a full-term newborn, maximum कितने ossification centers लेता? 5 ossification centers. What are those 5? Lower end of the femur, tibial tuberosity, calcaneus, talus, and tumor. Easy to remember is all of them are there in the lower limb. Newborn जब पैदा होता है, whenever a newborn is born, it is the he will have maximum 5 ossification centers. That is what you need to remember. Now, doctor, wonderful. I'm so happy to see almost 11 online students. Can the online students can punch whether the voice and broadcast are loud and clear for all of you, doctor? Can you please punch? Yes. Trigeminal neuralgia. It is also called cortical legs. Typically, commonly there is a sharp paroxysmal excruciating pain. One of the favorite questions of the examiner is, if tic doulorex like clinical presentation is there in a young individual, commonly what is the etiology? Remember, multiple sclerosis. You can't forget. It is the multiple sclerosis is what you need to remember. Can the online students can punch whether the voice is loud and clear for all of you? Sludder's neuralgia क्या होता है? It is the neuralgia of the spinopalatine ganglion. Typically, there is a sharp nasal pain in the distribution of the anterior ethmoidal nerve. Ethmoidal nerve. That is Sludder's neuralgia is what you have to emphatically remember. Now, doctor, Ansa cervicalis. What are all the muscles which are supplied by Ansa cervicalis is my question to all of you. It is the infrahyoid, inferior belly of the omohyoid, sternohyoid, sternothyroid. They're all supplied by Ansa cervicalis. Similarly, dermatome around the umbilicus, camera. So T10, ventral ramus around is what you have to basically remember. The great auricular nerve, what does it supply? So typically, doctor, the entire face cutaneous nerve supply is by the trigeminal. The only place where trigeminal does not supply is the skin over the angle of the jaw. That is in the parotid area. It is the great auricular nerve is what you should remember. Inferior alveolar nerve, it typically supplies the mylohyoid muscle, anterior belly of the digastric, the lower lip, incisors, they're all supplied by the inferior alveolar nerve. Then the pinna. What are all the nerves that supply? It is the mandibular nerve, superior alveolar nerves, which are the branches of the maxillary nerve. So the nerves of the pinna is mandibular nerve, whereas the superior alveolar nerve is a branch of the maxillary division of the fifth cranial nerve, is what you need to remember. Abhi aa gaya one of the favorite topics of the examiner, doctor. Superficial petrosal nerve, deep petrosal nerve, all the petrosal nerves you have to be very sure about. So the greater superficial petrosal nerve, it is the first branch of the facial nerve. It arrives from the geniculate ganglion. It joins the deep petrosal nerve in the foramen lacerum, and together the deep petrosal nerve and the greater superficial petrosal nerve together, they form the naru to pterygoid canal. Ultimately, this naru to pterygoid canal is the one which supplies the lacrimal gland, nasal, mucous glands of the pharynx and palate. So these are the 4 points you should remember about the greater superficial petrosal nerve. और एक बार बोल रहा हूँ, first branch of the facial nerve arising from the geniculate ganglion, and it combines with the deep petrosal nerve in the foramen lacerum, and it forms the nerve to pterygoid canal, and it supplies the lacrimal glands, nasal, mucous glands of the pharynx and palate is what you need to remember. Whereas the lesser superficial petrosal nerve, it is the branch of the tympanic plexus, the glossopharyngeal. It passes via aortic ganglion through the auriculotemporal branch of the mandibular nerve and ultimately supplies the parotid. Parotid ko kaun supply karega? Lesser superficial petrosal nerve, you should remember glossopharyngeal, and greater superficial petrosal nerve, you should remember geniculate ganglion and the facial nerve. And lacrimal glands, you should remember greater superficial petrosal nerve. Parotid gland, you should remember lesser superficial petrosal nerve. is what you have to ultimately remember. Then deep petrosal nerve. It is a branch of the sympathetic plexus around the internal carotid artery. It contains the cervical sympathetic fibers. Then external petrosal nerve बोल के एक रहता. So deep petrosal nerve is perfectly a sympathetic plexus around the ICA containing cervical sympathetic fibers. So greater superficial petrosal nerve, facial nerve. Lesser superficial petrosal nerve, glossopharyngeal. Deep petrosal nerve, sympathetic plexus. ये तो minimum याद रखना. Similarly, one more point, don't forget, otic ganglion बोले तो lesser superficial petrosal nerve. और geniculate ganglion बोले तो greater superficial petrosal nerve is what you have to ultimately remember. So, doctor, with this, we will conclude this short broadcast. Once more, another half an hour, I just need to finish one teleconsultation. So, within another half an hour, I'll once more restart another broadcast and send you the notification. Keep tuned. Thank you very much.